Alive and Well STL is a presentation of the St. Louis Regional Health Commission and RareGem Productions to build a healthier St. Louis. Power up with the positive. Learn more at oneraregem.com. That's ONERAREGEM.com.
Support for Alive and Well STL comes from Beyond Housing, helps entire communities become better places to live. Learn more at beyondhousing.org.
The Regional Health Commission works in partnership with regional health sector advocates and stakeholders to improve healthcare access, reduce health disparities, and improve health outcomes for the uninsured and the underinsured in St. Louis City and County.
Alive and Well STL with Bethany Johnson-Javois, CEO of the St. Louis Integrated Health Network and Managing Director of the Ferguson Commission.
Getting to Alive and Well with health coverage is the topic for today's show. We are joined here in the studio by Dr. Johnetta Craig, Chief Medical Officer at Family Care Health Centers, and Rosetta Keeton, Patient Access Consultant at the St. Louis Regional Health Commission.
And actually, as the Patient Access Consultant over at the Commission, when people call me, they call with this assurance and this almost like arrogance that I am a Gateway member. Man, this is what happened to me. And I don't know that people 10 years ago maybe had that opportunity or place that they could really just call and know that these people are there to help me with this. So that's one of the basic non-medical things that I see that has happened for patients. They can now have a sense of pride in belonging to an insurance program that causes them to have that respect that maybe they didn't feel before.
That's really an interesting perspective. I'm really happy to hear that, because I think for me, the biggest thing is recognizing and seeing relief from patients, both from the patient's perspective and mine. Because I now know that I don't have to worry like I have in the past that a patient can afford or be able to go ahead and follow the advice that I might be giving to them, because they don't have that fear of the bill that's going to come later.
We'll be right back.
Chief Executive Officer Robert Friend Jr.
And we think that's just an important piece of justice, that people who are sick get access to the same medicines and the same treatments as everybody else. What we're finding, though, is while that's necessary and important and just, it's not sufficient to build a healthy community. What we're finding more and more is that people can't be physically healthy unless they're mentally well, too.
Alive and Well STL.
Hello, and thank you again for joining us today. I am Bethany Johnson-Javois, host of Alive and Well STL and Managing Director of the Ferguson Commission. As we talk and think about what it means for our community to be alive and well, getting to alive and well with health coverage is the topic for today's show. We are joined here in the studio by Dr. Johnetta Craig, Chief Medical Officer at Family Care Health Centers, and Rosetta Keeton, Patient Access Consultant at the St. Louis Regional Health Commission, and also a longtime patient of Dr. Craig's. What an interesting relationship to bring you two into today.
Yeah.
And Dr. Craig, you take care of a lot of my family, literally and figuratively, so we have lots of connections in the room today. Both of you have spent your careers providing health care to those who are uninsured or underinsured, particularly those that are vulnerable in our region, St. Louis City and County. You have witnessed the health of individuals and families improve by providing access to high-quality, affordable health care services. So first of all, before I begin, we feel the need to say thank you to both of you for your career-long commitment to the people of this region. You have seen a lot of change in how we provide healthcare to those, and you've pushed a lot of change for how we provide healthcare to the vulnerable. Most recently, we have seen two major initiatives designed to help people receive assistance in accessing medical care. We've seen the implementation of the Federal Insurance Marketplace, or the exchange as some continue to call it, which can subsidize the cost of individual coverage for people who qualify. And in the absence of Medicaid expansion like we're experiencing in Missouri, we have a temporary program in St. Louis called Gateway to Better Health for those patients who don't make enough to qualify for those subsidies on the exchange. Today, we want to talk about the difference coverage makes in our health. If our listeners are out there wondering why they should try to sign up for coverage, we really want to provide them with some answers that they can act upon today. So to begin, Dr. Craig and Ms. Keeton, can you please describe how things have changed for your patients today compared to your patients 10 years ago, particularly for those who are uninsured?
So I suppose I should start here. That's a difficult question in just a small span of 10 years.
Okay.
But with the advent of the Gateway demonstration program, I think one of the differences that I see is that patients actually have gained a sort of respect that I think that they didn't have. I thought about that question a lot. And for people to feel that they have the respect of the persons that they need to encounter in order to get their medical care, I think is really important. And so they have this card that they can say, I am a member of, and that card allows them to enter into a system maybe thought of and looked at just a little bit different. Not necessarily that they would get any less care or any more care, but from their thought, they have now some empowerment and they feel that they have gained a type of respect. I hear that from people all the time. And actually, as the patient access consultant over at the commission, when people call me, they call with this assurance and this almost like arrogance that I am a Gateway member. Yeah. And this is what happened to me. And I don't know that people 10 years ago maybe had that opportunity or place that they could really just call and know that these people are there to help me with this. So that's one of the basic non-medical things that I see that has happened for patients. They can now have a sense of pride in belonging to an insurance program that causes them to have that respect that maybe they didn't feel before.
Dr. Craig, what are you seeing?
That's really an interesting perspective. I'm really happy to hear that because I think for me, the biggest thing is recognizing and seeing relief from patients, both from the patient's perspective and mine, because I now know that I don't have to worry like I have in the past that a patient can afford or be able to go ahead and follow the advice that I might be giving to them because they don't have that fear of the bill that's going to come later. I think that it is absolutely abhorrent that one of the major causes of bankruptcy in this country is medical debt. And so recognizing that having that access through Gateway to Better Health or, Lord willing, access to Medicaid expansion in this state will relieve patients of that anxiety. I will never forget the 42-year-old patient that I had that died of breast cancer because she was afraid to go and get the mammogram initially. And then finally she discovered a lump. And by the time she finally brought it to my attention, it was too late. But over the years, she had been avoiding going to get the mammogram because she was afraid of the bill. And that doesn't have to happen anymore. And so that I'm truly grateful for.
I've also seen some data that said that providers in the system also experience a lift from being able to really care for patients the way that they got into this business to do. Could you speak a little bit to that as well?
Absolutely. It makes so much. And in fact, that's why I have chosen to work with the patient population that I have, because I want to feel like I'm doing something for somebody who really needs my help. I have always believed that it's really important that poor people have the same access, the same respect, and the same belief that there is an advocate for them, that they are as deserving of high quality, compassionate care as anybody else. And so it does make a huge difference to know that I really am empowered, to really do the things that I want to do and to help people. Because that's why virtually everybody that gets into medicine, that's why they do it, is because they want to help people.
And what types of services specifically can you offer to someone who comes in your door that you simply could not that you weren't willing to, but you could not do without Gateway to Better Health?
Subspecialty care, preventive care, screenings like colonoscopies and mammograms, the immunizations, virtually everything. I mean, just giving them the confidence to take care of their chronic diseases because now they know they have a payment method for the frequent visits that are required, a way to pay for the medications that are required. Thank God for the $4 and $10 prescription programs, but for the Gateway patients, it's even more affordable than even that. So it allows people to take care of themselves rather than letting finances knock them out.
So as you're both discussing, peace of mind is something that's so important. We all value. And now perhaps we're finding some increasing peace of mind, although we're still in a tenuous circumstance in Missouri that we don't take for granted. So we hear people talk about the peace of mind they have, knowing there will be at least someone or some help in paying for their health care if they need it. And for decades, in some cases even longer, community health centers have provided this peace of mind to uninsured individuals, knowing that there was a place that they could go. Ms. Rosetta, can you explain the peace of mind effect? What does that do chemically, physically, emotionally, spiritually to a person when there's a piece of the stressor that they no longer have to deal with? Because life is already hard enough trying to just, walk through what you're dealing with now. What is the peace of mind like?
Wow. To explain the peace of mind that other people feel I wouldn't even start to try to speak to their peace of mind because it's so individual, and I'm sure it is different for each and every person. But what I see are people who, because they do have a peace of mind, are more cognizant of keeping regimens, doing things that make them better. And for me, for instance, if I don't have peace of mind, I'm all out of sorts. I'm just all out of sorts, period. I assume because I'm all out of sorts, everybody else that have that problem is all out of sorts too. So I usually judge everybody by me. If it's not making me happy, then I assume it don't make nobody else happy. So if you can't have peace of mind about getting your health care, because I hear so much of it when people are talking to me, I can't afford to go to the doctor because A, B, and C, and I'm just not going to go. I'm just not going to go. My blood pressure is just going to go up. I don't have the money to buy the blood pressure medicine. Yes, I'm supposed to go, but what do they think? Can I just come? That kind of just brain disorder energies going on. When you don't have that peace of mind to say, yes, I need to get to the doctor needs to see me every 3 months, and you can reason that. I found that when you are stressed and not functioning at your highest cognizant level, that you often get confused and forget a lot. I was happy to know it wasn't just an adult, old senior symptom. I found that people, regardless to their age, if they're stressed and everything is problematic for them, they forget. And the fact that you forget is going to cause more stress. And once you get that peace of mind, a lot of that is alleviated. And I think that's really important. Peace of mind keeps your hormones level, enzymes leveled, and it does for me. And I think I'm just an average Joe. So if I'm an average Joe, it probably happens for everybody.
So Dr. Craig, this is the point. I'm also an evangelist on the other side of one of my roles. I would do an altar call on peace of mind to ask people, to compel people to come. And so kind of in that same theme of peace of mind, I would like for you to work with me today for listeners who don't have peace of mind as related to their health, have the nagging issues, have symptoms that they've been ignoring, like this 42-year-old young woman. What is the peace of mind that a health center can offer if they just take the first step to enroll within Gateway? What can they expect? And it's more than just a doctor. It is the holistic team of people who are standing ready and waiting to receive you, literally. Can you talk to that person who is really struggling and just needs to make one step? What do they need to do?
I think that's really the big thing is making that first step and recognizing, like Rosetta said, how important that peace of mind is, because a lot of us take it for granted. Those of us who have been privileged, to be able to not have to deal with the stress of that financial axe, hanging over their heads. So by taking that first step and getting to a point where you don't have to worry about that part of it, like you also talked about, just the biochemistry of it is so huge, because by reducing those levels of stress, then you reduce those stressors on your body and, everything that goes along with it. And if people take that first step to get to the health center, it gives them entry to so many other things. The behavioral health consultants who can not only help them with that particular illness, but also teach them mindfulness, Teach them some biofeedback. Teach them how to look at all of the other non-medical issues in their lives and try to just become more cognizant, to get them skills to how to deal with everything else out there in their lives that can potentially be causing them to be off kilter and causing them stress. I mean, just granted, causing them stress. The more that we can relieve stress, I think the better off folks will be. Blood pressures will be better. Obesity will be better. The diabetes will be better. Everything stands to improve. And there is an entire team of people at the health centers ready and waiting to help them out. From the front desk with the financial access to Gateway, to the healthcare marketplace, to Medicaid, to the clinical providers, and all of the support staff that is so integral to making that happen. The medical assistants, the phlebotomists in the lab, the nurses, the physician assistants, the nurse practitioners, everybody is a part of the team. And we are all there to help.
So it sounds like to me that there are many resources that are waiting. And another benefit that people maybe didn't account for is as individuals apply for assistance, there may be assistance that they didn't even know that they qualified for. There may be gifts and opportunities and open doors that you may not even, listeners, know are available to you. So taking that first step to just understand that and to try. And I know sometimes people assume that the doors are closed. And this might be a season in your life where the door is open as related to healthcare, which opens up, as you said, so many different doors. So, Ms. Keeton, you have helped patients over the years navigate their coverage options. And with open enrollment for the federal insurance marketplace ending Saturday, February 15th, we got a little window of time that we want to encourage people to take advantage of this. What advice can you give to listeners as they review their coverage options? And what resources are available to help individuals and families right now in our community?
First of all, there are so many resources available. Probably if you look anywhere outside of your house, you'll probably find a resource. All of the community health centers have plenty of people collectively to assist. If you don't qualify for one service, you certainly may qualify for another, and they are certainly there to help you. Just a couple of weeks ago, I was at an event where they dedicated the whole, I think everybody in the city did one day last month, dedicated the whole day to just serving people. And there we were amongst them with Gateway, helping to take on the people and try to help them who didn't qualify for the marketplace. But the marketplace is everywhere. And I think you can even go to some Walgreens, and they have people there at Walgreens. People are trying to help each other to get some kind of coverage, not for the consequences that you can suffer, like paying the taxes at the end of the year, but because people need health care, because health care helps them to have that peace of mind, as we talked about. And so I urge everybody to just make that first step. Go to a health center in your community. Understand there are even insurance companies that offer the service. So just reach out to somebody and say, where can I get some help? And where can I get one of these insurance plans? And somebody certainly is going to help them.
Absolutely. Listeners, as a reminder, the open enrollment deadline is Saturday, February 15th, 2015. Enroll by this date and coverage can begin as soon as March 1st. Log on to www.healthcare.gov or visit your community health center today for more information on enrolling in the healthcare marketplace or for coverage through Gateway to Better Health. Start this new year by taking care of your health and getting covered. And before we close, Ms. Rosetta or Dr. Craig, is there anything else that you want to share with listeners?
Nothing other than really one of the things that I like to tell my patients is that you are the captain of the team. And until they reach out and they make that first step, nothing's going to happen. And so you really need to understand that there are so many resources. There's so many people out there who want to help. All you've got to do is just step out the door or pick up the phone and call and ask for it. We'll be there.
And in my closing, I just want to say to everybody, getting some kind of coverage is a good step to becoming alive and well.
There's no better way to close this episode. So I want to thank everyone for joining us. Thank you, Dr. Craig. Thank you, as always, Ms. Rosetta. and thank everyone for joining us for another episode of Alive and Well STL.
Alive and Well STL.
We are grateful for your gift of time to this conversation. We encourage you to stay involved and get involved.
You are invited to join the conversation. If you, your family, or your organization is interested in talking about how we better the well-being of the region, sign up for more information, join the conversation, log on to aliveandwellstl.com, and let's build a plan on how we can work together and improve our overall health and become alive and well. The Regional Health Commission with Chief Executive Officer Robert Friend Jr. committed to providing a detailed review of change over the past decade in 14 leading health indicators for the city and county of St. Louis. The first decade review of health status report, an update to building a healthier St. Louis. Discover the narrative, the data, and celebrate the progress already made to improve healthcare access and reduce health disparities in our region. Learn more at stlrhc.org. Alive and Well STL is another positive production of RareGem Productions. Thanks for listening.